Hello, my name is Dr. Bernardine Evans. I'm a physical therapist and a geriatric board certified specialist, clinical assistant professor at Howard University. Today I'm coming to you to talk about falls awareness. What a physical therapist wants to tell you about falls awareness is that falls awareness leads to falls prevention. And this is directly tied to movement and how you move. Physical therapists are the movement specialists. So the two leading sources of information that I'm using to give this talk to you are the Balance and Falls Public Health section of the American Physical Therapy Association, which I'm a member of, and also the Centers for Disease Control and Prevention, which regulates the data for the United States of America. So here we have a gentleman who is just blissfully unaware. He's having a ball, but he's blissfully unaware of his risk for fall, and also unaware of the impact that a fall could or would have on his life. So as we go through this talk today, we're going to try to make the people listening not like this gentleman, not like the previous gentleman, unaware. We want to make you aware. We want to make you aware of your individual risk for falls. We want to make you aware of what you as an individual can do to protect yourself from falls. So we have this gentleman here who's the promo is take a stand against falls. Don't let a fall strip you of your independence. And that's really one of the factors that falls have. So we have people who fall, they get injured, but they live with a decreased quality of life. It may impact how they walk. They may have pain that limits their mobility, amongst other things. We have people who fall and they die. So these are two kind of outcomes that we hope no one experiences, but we know that they do. If you are concerned about that and you want to know more, you're going to listen to me today for a few minutes, but we also want to go to the website. We want to go to cdc.gov and look at what the resources are that they have. They have them in Spanish, they have them in English, so you'll be able to get a lot of this information that I'm talking about today by going to that website. So next we have a statement that 1 in 4 people 65 and older fall each year. This is a very significant amount of falls. Now notice it doesn't say that people are injured, that people die, but it says that this is the amount of people who fall. And this begs the question, what is a fall? So what we know is that a fall is an unplanned descent from one surface to another. It doesn't say that we hit the floor. Some people fall into a chair. Some people fall off of a higher bed onto a lower bed, but it is a fall. Now, people can get injured in an instance where they don't hit the floor. Many times when I ask this question, I have someone who actually has fallen, but they tell me they didn't because they don't qualify. Oh, that was just an outlier. I really didn't do that. I slipped, or, so-and-so pushed me. That's not something that you want to be picky about. If you fell, you fell. And you need to own up to it. It gives us, and let the practitioner who's talking to you, your doctor, your physical therapist, your personal trainer, whoever, let them be the ones who decide whether that's a significant fall or not. And most definitely, if you fall from a level above the floor onto the floor, that's something you definitely need to be seen about, and something you should definitely report. Okay, the PT, the physical therapist in me is coming out. What does a physical therapist want you to do? today, if you do nothing else, if you hear nothing else that I say in this talk, what I want you to do is to keep moving. What any therapist wants you to do is keep moving. What your doctor wants you to do is keep moving. You want to keep active. You want to maintain your balance. This is what's going to help you prevent falls. So my job today is to say, well, how are you going to do it? What are some ideas? What are some resources to help keep you moving? What we don't want to hear is that you are afraid of falling, and so you don't move. What we don't want to hear is that you're having so much pain that you can't move. All of these things are things that need to be treated, things that need to be addressed so that you keep moving. So again, you can find this on cdc.gov if you so choose. Here we have some of the bullet points for today. What we're going to do is look at the importance of falls prevention in the United States. We're going to look at the impact of falls, especially in minority populations and especially between genders, male, female. We're going to describe the role of the physical therapist. Many people don't know when to see the physical therapist. Do I have to already have fallen? And we're going to answer that today. And you know that answer is no. So we're going to identify leading factors as to why falls occur. We're going to recognize interventions that can reduce the risk for falls. What should I do now that I know that I'm a moderate to high risk for falls? What should I do? And then we're going to be able to visualize the factors in our individual lives that impact personal risk. And so I want you to come away from this with some idea of what your personal risk is for falls. As we look at statistics, and I'm going to tell you now, these statistics come from the Balance and Falls public health section under the American Physical Therapy Association. So if your physical therapist goes to the website, they can get this data. They can get the full article. What I'm going to do is just kind of in a nutshell give you what the article has proven or claims to have proven. So here we have older adult deaths from falls increasing. So you're going to see me repeat this data several times during the talk. Just so you know, it's not getting better. And it's not getting better because we're not addressing it. It's not getting better because we're living longer. The population of senior or older adults is growing. So if we want to be ahead of the curve, we have to provide more services. We have to be focused on those things that seem to increase as we age, and falls are one of them. So deaths from falls, which is that outlier of falls, are increasing. I know when I first started talking about falls many moons ago, one of the statistics that hit me was that in older adults, the majority, it was something like 50% at the time. I think I lived in Prince George's County at the time in Maryland. 50% of older adults died within a year after having a hip fracture. That hit me. It made me take the treatment that I did with persons who had hip fractures much, much more seriously, because it wasn't just a spell of illness. This was a life and death thing. So that's something I want you to come away with, is that this can impact your life, not just your quality of life, but the longevity of how long you're on this earth. Falls prevention exercise interventions work. So you may have heard of falls programs like Otago. Today you're going to hear about Steady, their Fame. There are many different interventions for falls, and we call this one multifocal or various interventions. Tai Chi, I Chi, Qigong, all of these types of activities have studies behind them that show that they can decrease a person's risk for falls. So there's strong evidence to that. Physical therapist in the emergency room. Who would have thunk it? So physical therapists can provide education. They can provide interventions to people who come to the emergency room because of a fall that decrease the chance of that person coming back. So we can provide instruction so that if we look 30 days out from your ER visit, 35% less than if you never saw a physical therapist. If we look 60 days out from your visit, 32% less than if you never saw a physical therapist. So if you fall, a referral to a physical therapist is a good idea, because you don't want to do it again, and you don't want to assume that it was just a fluke. You want to really get screened, get on board with a plan for yourself so that this doesn't become a trend. Okay. Falls related deaths in the US rose 31% in 10 years. So the last decade, I think this went from 2007 to 2015, 16. So if you look at the CDC statistics, we need more screening, more prevention efforts, including physical therapy, so that people don't fall. We don't want people dying from something that's preventable. So that's what this statistic tells me. Falls amongst US adults 65 and older. If you look at Medicare, Medicaid payments, 6% of all Medicare payments and 8% of all Medicaid payments were directly related to falls. And this totaled $50 billion in 2015. I am positive that that amount has just grown. I have not heard anything to say that it has decreased. If we look at some questions, I'm a professor at a university, so, we like exams and questions. So this question says between 2007 and 2016, death rates due to falls in the US increased by what percentage? And as you know, the highest amount on there is 31%, and that's what it is. Okay, so 31% increase in death rates. Another question, back to that ER visit. So this one asks about location. And if you're in real estate, it says location, location, location. So we know that the most risky location for the bathroom, for the home, is in the bathroom. That's where most falls happen. And for those of you who do the trek to Mecca every night to the bathroom, for whatever reason, you know why. Groggy. Sometimes you don't even remember. You just have the audio of, yes, I did. I remember trudging and the flushing and going back to bed. So this activity tends to lead to falls. However, what comes next? So what we know, if we have the kitchen, the bedroom, the stairs, the living room, the bedroom is the next most risky place. So this is according to caregiverstress.com. So if we go to the next location, it's the kitchen. So we have bathroom, bedroom, kitchen, and last, stairs. The thing that stairs has to is an advantage is that stairs scare people. People just stop going upstairs at some point in time because they're scared. Now, as physical therapists, we don't believe that. We believe stairs are an opportunity, and they're an opportunity to get strong. They're an opportunity to stay strong, but you got to do it smart. So if you find you can't go up and down the stairs anymore, that's a good time to ask a therapist. That's a good referral, because that's what we do. We train people. I have a patient, a family member living with me now, who I'm training and with his actual physical therapist. I don't want to be his main, but training to get back up them steps, doing a fantastic job of it. So that's what we do. We're here for that. The next thing we have, men and women. Is it a difference in the person who has the non-fatal falls and the person who has the fatal fall? And we know that it is a difference. So women, the answer here is C. Women have higher rates for falls, but men have higher death rates related to falls, according to the CDC. So is that because men tend to do more risky activities like ladder climbing and drinking? We don't know, but we know that when we look at the statistics of who dies from a fall, tends to be the male more so than the female. Another study in the Journal of Preventive Medicine, American Journal of Preventive Medicine, found that the falls risk factor that affects the largest number of adults 65 and over is home hazards. So when you talk with your occupational therapist about what you can do in the home that can reduce your risk for falls, this is most important because it is what we all can change. There's not one of us that can't change the home hazard and reduce our risk. And these are things like throw rugs that we can catch our toes on, cords that are across the room ready to trip us up, clutter that's below the knee to the floor. And you see me in my office, and there's something about workspace, things tend to start piling up on the floor. So, you know, I've got to do my own home hazard check and work on that. But this is a significant thing that people have to do to reduce fall risk. I have to say, because generally I'm talking to majority minority populations, when you get to people of darker skin complexion, vitamin D deficiency is a big deal. Majority of people with African American or Latino descent have vitamin D deficiency, and we know this impacts a person's movement. Now, the literature goes back and forth as to the significance of how it relates to your falls risk, but I can tell you now, it definitely relates to your mobility. So I highly encourage people to be aware of their vitamin D intake and whether they're deficient or not. Medications, you will have nursing and physicians talk to you about that in other lectures, but that is also impactful in vision. The three things that we know that are how people keep their balance are your muscles and joints, which we call somatosensory, muscles and joints, your vision, and then this other thing in your inner ear called the vestibular. So without those three things, you don't know where you are in space and you fall. Polypharmacy is the fact that as we age, we tend to take more drugs because we got more things that are breaking down, more things we have to fix. So the more drugs you take, that tends to link you to a higher falls risk. So it is great that physicians are trying to decrease a patient's dependence on drugs, but it is not great if you decide you're just not going to take them because you're trying not to increase your falls risk. That's not the idea. The idea is that you no longer need the medication because you have made healthy choices that are changing your dependence on them. So for those of us who have to take medications on a regular basis, the blood pressure medications, the pain medications, the antihistamines, the cold medicines, the anti-anxiety medicines, those are the ones that tend to have direct links to fall risk. So there are drugs like gabapentin, amlodipine, there are drugs like codeine and opioids that either decrease your alertness and make you more likely to fall, or decrease your ability to respond or react to a change in position. So they usually will come with a label on them that say falls risk or falls precautions on them. And so those are the ones you don't want to pick that time to climb the ladder or to decorate the Christmas tree and put the angel on top. Those are things that you're not going to do when you have an increased risk for falls due to medications. Activity. Physical therapists, and I tell my students this all the time, what do I do to decrease my falls risk, or what is the most beneficial way? to have a healthy change due to exercise, and that's function. So yes, we love exercise. Yes, we like to do these planned activities that actually don't, do anything for us, but the most beneficial are the functional ones. So in the study in the Journal of Aging and Physical Activity, they had four activities: gardening, driving a car, shopping, and light household chores. Which one of these had the most impact on reducing falls risk? It was gardening. Gardening improves balance. It improves gait speed. So we call gait speed the fifth vital sign, or the sixth. So we have heart rate, blood pressure, respirations, pulse ox. We have pain and gait speed. Those are the things that physical therapists look at, and it tells us the state of our patient's wellness, the state of their physical fitness. So if we look at the next one, we see two people gardening, which has become a very, very popular thing for all ages during COVID, because you can do it in social distance. I have started gardening more than ever. I have had, man, tell you, weed pulling, will do it every time. That's the most rigorous activity next to cleaning out a horse barn after in the summer. Those two activities that I have done are the most rigorous and require many aspects of movement. So look at the flexibility, this person of the knees, and the strength to be able to squat in that position. And you tend to garden for a long period of time. I tell you one thing, you garden a lot longer than you will exercising, because sometimes you'll be out there for hours. And if you do an exercise routine, you might last 20, 30 minutes. And some of you last 45 to 60, but you won't be doing it for hours, unless you're a marathon runner or an athlete. STEADY. STEADY stands for Stopping Elderly Accidents, Deaths, and Injuries. STEADY is a program that the CDC runs. They have a website, and I'm going to try to pull it up in a little bit to show you what is on that website. I would like all of you to access, not only if you go to cdc.gov, you can go to STEADY, and it has all of the resources. It has it has facts about fall prevention. It has how you access the physical therapist, the doctor, what questions you should be asked, or how you have to manage yourself to decrease your risk for falls, or to find out if you have a risk for falls. So I encourage that. We're going to look at that in a second. But on that site, you're going to see a question. It says, what conditions make you more likely to fall? Well, what we know is lower body weakness. As physical therapists, we focus on whether a person has what we call weakness of certain large muscle groups. And these tend to be the reasons that people fall who don't have neurological problems, but they are falling. So we'll talk about that on the next slide in a little bit. Vitamin D deficiency, I've already talked about, especially in minority populations. Difficulty walking or balance. Sometimes it's not that you have weakness in your legs, it's that you have abnormal movement. And if you have chronic disease, especially the neurological diseases like Parkinson's, stroke, some of the joint diseases like lupus, those things can give you difficulty when you're walking. And that also can impact your ability to maintain your balance. Medications, the polypharmacy again, vision problems, anything, the lighting in the room, your personal vision, your visual aid being not the right fit. Those things decrease your ability. You'll find that if you become weak or you have decreased sensation, that you have to look at things sometimes. You can't just do it anymore without looking. You've got to use your vision. And if your vision is impaired, it decreases your ability to do the task. We're going to talk a little bit about foot pain and foot wear. If your feet hurt for whatever reason, if you got the gout, if you got a ingrown toenail or a corn or whatever, that can change how you walk and change your gait, which is a term physical therapists use for how you walk, and make it more likely that you're going to trip and fall. So we'll talk a little bit about footwear and, of course, home hazards. I hope you hear a lot about that from your OT, who will talk to you. So what do we need you to do to reduce your risk of falling? We need you to talk to your doctor, and we need you to be truthful to your doctor. When he says, have you fallen? No, I didn't hit the floor, but I did fall. I fell down from the sixth step to the second step. Or however it is. If it was uncontrolled and unexpected, then it was a fall. We want you to keep moving. This is your healthcare professional that's involved with you staying active. This is your physical therapist, your occupational therapist, your personal trainer, your athletic trainer. This is anyone who keeps you moving and keeps you motivated to move. Remove clutter. Remove clutter means that you're going to get that stuff that's down on the floor. You know, I know that we have clutter up high in cabinets, but we're concerned about what the things that are going to make you trip and fall. So get that clutter from the knee down and move it up out of the way. So let's take action. We're going to strengthen the knee flexors, which are the hamstrings on the back of the leg. We're going to strengthen those knee extensors, because if we don't have the knee extensors, guess what? You're not getting out of that chair without using your arms. So if you're at the point now where you got to use your arms, or you got to do the multiple times to get out of the chair, you got 1, 2, 3, and you get up, then you got weak knee extensors. And that's something that you can work on with your physical therapist and your personal trainer. Hip abductors, those are the muscles that keep you walking at hip distance. Some people start walking and their feet are so close together you can't, and their toes are tripping each other up. Some people are so unstable that they walk and their feet are wide apart. The hip abductors are the muscles on the outside in your pockets, and those help you to kind of maintain your legs at a set distance. Then we have ankle muscles. This is the joint. This is the part of the body that is the forgotten part. I find a lot of times that people don't even know that they've lost strength in their ankles. They don't know that they've lost mobility in their ankles until you put them on a ramp, a hill. You ask them to go on the stairs, and you see the decreased mobility. And ankles are very important. That's the reason you can stand still and not have to hold on to anything. So there are many times where I start testing people and I do screens for falls, and there's a person who's just totally unaware that the ankles are not functioning anymore. And this is definitely a reason that someone would fall. The next thing is walking. Walking is an activity that we don't directly link with reduced risk for falls, but we do link it with your quality of life and your healthy quality of life. So how much walking should you do if your goal is to prevent falls? That is 30 minutes twice a week, and or 3 sets of 10 minutes count. So remember, it's cumulative. So as long as you do it at least 10 minutes, you don't have to do it all at once. You can walk for 10 minutes, take a break, walk for 10 minutes later in the day, take a break, walk for 10 minutes later in the day. That's 30 minutes for that day. Now you can't do it like 10 minutes for 5 days. It doesn't work that way. So you do it in a day, but do it in 10-minute intervals. So that's just enough. That's not a lot of walking if you look at it, but that little bit of walking will improve your cardiovascular fitness, which can improve your ability to stay healthy and not fall. Balance retraining. Okay, if you have fallen, you're going to start balance retraining in what we call supported activities. You're going to be holding on to something. Please don't try to, be the diva ballerina all of a sudden, and you know that you're a faller. You're going to hold on to something. If you suspect that you're at risk for falls, but you don't use an assistive device and you're walking around just fine. I'm not talking about those of you who just refuse to use the cane, and we all know that you need it, but you're in denial. I'm not talking about that person. I'm talking about the person who has a normal way of moving, and they want to start working on or doing things to work on their balance. These are unsupported activities. So this is Tai Chi. This is someone who's able to do that and not sit in a chair and be on their feet. So those are the types of things that we'll work on balance. Functional activities, the functional things work for me. I like to see people that have hobbies that are physically active, get you on your feet and make you do. And gardening, of course, is a top activity. If the shoe fits, your shoes, there are people that come to me and I do the assessment. I don't find they have strength issues. I don't really find that they have balance or coordination issues, but they have horrible shoes. And these are shoes that maybe they were great when they were 20 or 30, but now that they're 60, 70, it's just not working. So what we want to know about the shoe is this shoe causing us to fall? So I'm going to stop sharing for a second on this and go back to my screen. Hold on, see if I can get to it. It keeps going back to the PowerPoint. Hold on a second. Let me stop this PowerPoint. Okay, and we'll go to my next slide. Hold on a second. Apologize for the disruption. Let's see where I have a, here we go. Okay, so let's go to the shoe fits. Okay, so when we look at shoes for older adults, I don't really like the term elderly because I'm starting to resemble that remark, but we want to look for fit and comfort. Shoes should not hurt, especially, and I'm telling you, every decade of my life, I used to be able to tolerate uncomfortable shoes. Now it's no tolerance. So you want to wear shoes that don't promote foot pain. They need to be sturdy and supportive. They don't have to be heavy and bulky, but they need to be supportive, which means that they support your arch. They cushion your heel, because you don't want to have spurs and things that cause more pain. Non-skid soles. Non-skid soles are great for socks. Non-skid soles for shoes, as long as they're not on the toe. There's some shoes that are designed where the toe has the skid, and that can cause a person to fall. Custom shoes. There are custom shoe makers. Nordstrom does custom shoes. Some of the pharmacies that have what we call pet orthotists do custom shoes that if you have one foot that's bigger than the other, if you have swelling or edema problems, and you have bought bigger shoes because sometimes you have swelling, that's, that, especially if you're diabetic, is not a good fix. If you're diabetic, you're entitled to shoes annually through your Medicare. Get them. It's well worth it. You don't need to be falling. So don't go and have 4 pairs of the same shoe in different sizes for whatever your swelling is. That's a recipe for a fall. There's shoes like New Balance and SAS, the SAS shoes, that are really, really great shoes if you are likely to fall. So I'm going to go to, let's see, the CDC and just review very quickly. This is the Steady website, and this one gives you all of the important facts about falls. I won't go over them in depth because we've gone over some important ones. But what I like here is that it says what can happen. Why are we concerned about a fall? Because falls can cause broken bones in the wrist, arm, ankle, and hip. Falls can cause head injuries, and as that's one of my specialties in physical therapy. I work with traumatic brain injury and closed head injury, and it's no joke. Just tripping in on a sidewalk and hitting your head, it's no joke. And then many people who fall, even though they don't get injured, become afraid of falling, and that's called tophobia. Tophobia is a fear of falling, and it actually makes you more likely to fall, and people stop moving and they become weaker, and they start to develop the things that physiologically make you more likely to fall. So look over this website. It talks about how do you talk to your doctor, what types of things you need to do in your home, and I highly recommend reviewing that. The other thing is, this is an article that is on the American Physical Therapy Association website, but it basically gives you what we look at as physical therapists. So if you come to a physical therapist, you come to me, what types of things will I look at? What will I recommend? So I'm going to look at whether you've fallen before. I'm going to look at your medication. I'm going to look at whether you have osteoporosis, whether you have depression. Those are things that I will have some type of screen that I will use to see if you need to be referred to a professional and work on that. And yes, depression does increase your risk for falls. The other thing I'm going to look at is your strength and balance. I'm going to look at especially your lower extremity or leg strength. There are assessments that we do even for this falls prevention. We usually do something called a 5-time sit to stand, or we do a tug, a timed up and go. And the tug tells us about gait speed, and it lets us know your risk for falls. The 5-time sit to stand, and you should be able to do that in under 30 seconds. If you, without using your arms, if you are what we call quote unquote normal. But that tells us about your leg strength. So we usually look at both of those things when we look at a person at risk for falls. Your cognitive, your neurologic levels. We test whether you have any altered mental status or dizziness. All of those things can impact your risk for falls. Your cardiovascular, if you're a person that tends to get lightheaded when they first get out of bed, or they have orthostatic hypotension where you get up and down, that can impact and cause you to have periods where you just fall out. Incontinence, if you're rushing because you got to go, that's the perfect time to fall. Vision we talked about, and then functional things like walking. ADLs are activities of daily living. Your occupational therapist can help you in those areas of dressing, bathing, even higher levels like cooking and moving around your kitchen, keeping you active. And then is your activity level right for you, right for your lifestyle? We look at your environment, we look at personal factors, your culture, alcohol use, and of course, footwear. So these are the things that physical therapists can help you with. I hope at the end of this talk that you are all able to go on the CDC website and look at the interventions, connect with a physical therapist if possible. If you know that you're falling and you know that you have a chronic condition and you're not being followed, you need to contact your therapist. If you don't and you are concerned about your health, your risk for falls, you can go to a place like the Senior Wellness Center that has has trained professionals there, that has a personal trainer there, that has classes that are specifically designed to reduce fall risk. and work on lower extremity strength and work on your ability to maintain balance. And of course, we at Howard University, the Department of Physical Therapy, Department of Occupational Therapy, you can call us, you can contact us and go on the Howard University website, and we are more than willing to touch base. We are more than willing to come out and do an outreach and to do screenings. And of course, once COVID is alleviated, we hope to resume those. So thank you again for inviting me to talk on Falls Awareness Day. And I am wishing you all safety. I'm wishing you all wellness and peace. Bye-bye.